Hello and welcome. I'm your host, Maria Cancel. Welcome to the Stroke Awareness Program. Stroke is the leading cause of long-term disability and the fifth leading cause of death in the United States. Yet 80% of strokes are preventable. You'll learn what a stroke is, the signs, symptoms, risk factors, and importance of seeking immediate medical attention when experiencing stroke symptoms. Our team of professionals will discuss how you can reduce your risk, understand the symptoms that you, friends, or family members may have in the event of a stroke, and the treatment available. Time is of the essence when it comes to treating a stroke. Early intervention can make a significant difference in the outcome. The faster a stroke is treated, the better the chances are for a full recovery. Whether you're looking to reduce your own risk of stroke or help others recognize and respond to the signs of a stroke, this program will provide you with valuable information to increase your stroke awareness. Here to do that is Dr. Bob Weinstein, Chief of Primary Care at Signature Medical Group. Welcome, Dr. Weinstein.
Thank you.
Dr. Weinstein, can you tell us what a stroke is?
A stroke occurs when you have a blood clot form either in large blood vessels in your neck or in your heart if you have valve problems or irregular heartbeats, and a clot spreads to your brain and suddenly cuts off the blood flow to the brain. Sometimes clots can form directly in the brain itself, or less commonly it's from a bleed into the brain from a blood vessel that has broken open.
And what are the symptoms of a stroke?
The most common symptoms are going to be sudden loss of function, be it a motor function, you can't move something, your vision goes, you can't speak, you can't feel something. Dizziness can be a presenting symptom of a stroke. Commonly people think that headaches have to go along with strokes, but it's not very often that a headache is associated with a stroke.
And what should I do if I think I'm having a stroke?
There are proven treatments that we now have that can really reduce the long-term losses from a stroke, but they are very time sensitive, so it's important that you get to care as quickly as you can. You can call your primary care provider to see if he or she feels you should go to the emergency room, but if the response isn't very quick, you should call 911 and get to the emergency room.
And how can I reduce my chances of having a stroke?
This is the most important part, and this goes along with all the other kinds of lifestyle treatment kinds of things that we speak about. Smoking is a very, very big risk factor. Hypertension, diabetes, high cholesterol. All of those things are modifiable, things that you can actually change with the help of your provider and others to reduce your risk of stroke. Family history is also a risk factor, though you can't change who your parents are.
Indeed, you can't.
No.
And when should I see my PCP after I've had a stroke?
This is important. After you have the stroke, typically you would have been admitted to the hospital. They would have done some investigations and started you on various treatments. It's important that you see your PCP after you're discharged, because many times there'll be further testing that will be important to do to make sure that you don't have more strokes afterwards. There are also some interventions, things like physical therapy, occupational speech therapy that we can put into play to help you learn how to function after the stroke.
Dr. Weinstein, thank you so much for this valuable information, for sharing with us. When stroke awareness continues, we take a look at the impact of emergency medical response when a stroke occurs. Hello, I'm Maria Cancel, and we continue the Stroke Awareness Project with a discussion about the emergency medical response impact on strokes. For this, we welcome our next guest, Dr. Muse. Dr. Daniel Muse is the Emergency Department Physician and Medical Director of Emergency Medical Services at Signature Healthcare Brockton Hospital. How would I know if somebody's having a stroke?
Well, there's a classic stroke where you have weakness on one side of the body and maybe a facial droop and also speech problems. That's the one that we typically talk about. But there can be a lot of subtleties that occur, such as confusion, imbalance, the headaches. You might have also just a person having nothing more than a little bit of loss of vision, or having problems just with specific words. And these are all indicative of a possible stroke. The brain is an extremely complex organ, and any part of it can be affected. And if it is affected, then that part may manifest itself with some types of changes in the person.
And what should I do if I believe that a friend or a family member is having a stroke? What are the next steps?
Think fast. We use that acronym. F is for face, arm, S is for speech, and then T is for time. And when you're thinking fast, it allows you to sort of view the person in that format. So if a person has any neurologic findings, then you're going to want to call 911 immediately. That is the time, and you also then want to relay any information that may be beneficial for the dispatcher to relay to the medics themselves.
And what should I do while we wait for the ambulance?
Well, you'll be assisted, and in the process of waiting for the ambulance, the dispatcher is going to start asking for some information. In particular, they're going to want to know when the stroke began. That's very important in terms of what allows us to be able to help the person. If the stroke came on very early, then we can use some modalities such as TPA, and this can help dissolve the clot. It also allows us to determine where would be the best location to take the person. And lastly, collect information about the patient's health so that that can be relayed to the hospital staff and medics as well.
And what can I expect when the ambulance arrives?
Well, there'll be some redundancy. They're going to ask some of the same questions, but they're going to want to know when the stroke began. As I said, this is very important to determine how best to treat the person. And they're going to want to know other medical conditions they have. You'll see the medics themselves perform some things on the person. They'll start an IV, they'll give oxygen, they'll be placing EKG leads on the person to determine what's going on with the heart. And then they'll try to get the person onto the ambulance as quick as possible so that they can get to the appropriate facility. Now, these facilities are going to be determined by the extent of the stroke. The Brockton Hospital, Good Samaritan Hospital are both stroke centers and provide excellent care. But there's also at times an extremely large stroke that needs more aggressive intervention, where they literally will go in and remove the clot from the brain. Now, this can only be done at certain hospitals in Boston, and if they make that determination that this possibly is what we refer to as a large vessel stroke, then they will plan on taking the person to one of the appropriate facilities in Boston.
Any last thoughts you'd like to share?
Well, I already said, and I'll say it again. Think fast. F is for face, A is for arm or leg, weakness and numbness. S is for speech, whether it is they don't understand what you're saying or you have trouble understanding what they are saying. And T is for time. Time is of an essence in terms of when the stroke started, but also time is important in that you don't delay in calling 911.
Thank you, Dr. Muse. Thanks again to Dr. Muse for his time and advice. When we come back, we have more stroke awareness recommendations and insights to hopefully minimize the damage a stroke can have on you or somebody else, so stay with us. Welcome back to the Stroke Awareness Project. I'm your host, Maria Cancel. We know that time is extremely important when dealing with a stroke, and getting to the emergency room is critical for minimizing the impact of a stroke and the subsequent recovery from a stroke. Here to talk about what to expect at the emergency room is my next guest, Dr. Laura Griffin, Chief of Emergency Medicine at Signature Healthcare Brockton Hospital. Welcome to the Stroke Awareness Project, Dr. Griffin.
Thank you.
Dr. Griffin, what happens when I arrive to the emergency department?
Sure. So after you arrive to the emergency department, you will be immediately assessed by a physician and nurse. You will have a rapid physical exam performed to assess your stroke-like symptoms. An IV will be established if it wasn't done so by EMS, and a blood sugar checked. You'll have an EKG and vital signs obtained, And again, it is very important to call 911 at the onset of your symptoms to receive time-sensitive stroke care.
And what type of testing do I need in the emergency department?
The most important test you'll get is a CAT scan of your head. This is a quick test and it is not an enclosed unit, and this will help determine the type of stroke that you've had. In addition to that, you'll have blood work including electrolytes and kidney function. Sometimes patients require an MRI, but that does not typically happen from the emergency department.
And will I see a specialist?
You will. You'll first be seen by an emergency medicine physician, and you will also be seen by a neurologist via telemedicine through Beth Israel Deaconess Medical Center. Many hospitals, but not all, will have a neurologist via a telemedicine service. They will ask you questions about your stroke symptoms and have you perform various physical tasks via the video screen.
And is there treatment for a stroke?
There is. There's a medicine that is considered to be a clot-busting medication called TPA. The emergency medicine physician and the neurologist will determine if you are a candidate for this medication. The medication does come with risks, particularly bleeding, and it has to be administered typically within 3 hours of symptom onset. Again, that's why it's imperative you call 911 at the first sign of your symptoms. The neurologist will determine if you are a candidate for this medication and discuss the risk with both you and family before it is administered. There's also a procedure that can remove the blood clot. This would happen at a tertiary care hospital, and if you're a candidate for this treatment, it is decided by the neurologist based on your symptoms and CAT scan findings.
Will I need to stay in the hospital?
Yes, if you receive the TPA medication, you'll need to stay. If you receive the procedure to remove the clot, you'll need to stay. If you are not a candidate for either of those treatments and you still have symptoms, or even if your symptoms are improving, you will still need to stay in the hospital for further testing and observation.
Dr. Griffin, thank you so much for this important information.
Thank you.
We'll continue with more stroke awareness after the break. Stay with us to find out more about a stroke and how to address it. Hello, and welcome back to the Stroke Awareness Project. I'm your host, Maria Cancel. We're now joined by Dr. David Miller, Chief of Neurology at Good Samaritan Medical Center in Brockton, Massachusetts, an expert in stroke prevention and recovery. Dr. Miller, what is a stroke and how is it diagnosed?
Basically, a stroke is what happens when there's a blood clot in one of the blood vessels in the brain, and for that reason, that particular area of the brain will become injured, and that is what we see when we do imaging of the brain, and that's what we call the stroke, is that area of injury. Now, there's also a separate condition known as a transient ischemic attack, or TIA, and that's what occurs when you have a similar issue with blood clot, but the blood clot dissolves before there's time for any injury. And so when we do the imaging, we don't see any abnormalities, but both stroke and TIA are treated very similarly with the same testing and similar medications.
For a patient suspected of having a stroke, what diagnostic tests are performed on initial arrival to the hospital?
So initially we do a number of tests. Probably the most important test that we do is a CT scan of the head. And the reason we do that test is to exclude the possibility of a different type of stroke known as a hemorrhagic stroke. That could best be described as a brain bleed. And the reason that we want to know about that if it's going on is because it's treated very differently than the other type of stroke. Whereas the stroke that I mentioned before, called an ischemic stroke, is often treated with a medication that could be described as a clot buster. That would not be appropriate for a hemorrhagic stroke.
What are the risk factors for stroke?
Risk factors for stroke include cigarette smoking, advanced age, diabetes, high blood pressure, high cholesterol. It's important to keep these risk factors in mind because the testing that we do is aimed at looking for those and aiming to address those issues.
And what type of testing can be expected after the initial assessment in the emergency room?
So after we have assessed the patient in the emergency room, what we typically do is we will look to obtain an MRI, which is a high-resolution form of imaging. It can find areas of brain injury that a CT scan wouldn't be able to. We also do other types of testing, such as testing on the heart, for example, an echocardiogram to look for structural defects that might put a patient at risk for strokes. We also do heart monitoring to look for arrhythmias that could also predispose a patient towards stroke. And we will do tests on the blood vessels of the neck, which can also be a source for stroke.
Is the testing completed by the time the patient leaves the hospital?
Mostly yes, but one test that we often do after a patient leaves the hospital is a longer-term heart monitoring. And that's because the longer we look at the heart, the more likely we are to pick up on an abnormality if it's there. Also, sometimes there are blood tests that haven't resulted by the time a patient leaves the hospital. So for that reason, it's important for patients to continue to have their medical follow-ups to reduce the risk of any issues happening in the future.
Dr. Miller, thank you so much. This is very informative.
Thank you for having me.
Of course. We'll be back with more from the Stroke Awareness Project in a moment. Hello and welcome back to the Stroke Awareness Project. I'm your host, Maria Cancel. Now we turn our focus to advancements in stroke intervention and rehabilitation. Joining me to do this is my next guest, Dr. Bridget Dwyer, Program Medical Director of Vascular Brain Injury at Encompass Health Rehabilitation Hospital of Braintree and Assistant Professor at Boston University School of Medicine. What are some of the advanced interventions for stroke in recent years?
You know, stroke happens to be one of those fields that has really rapidly changed over the last few years. And a couple of the technologies that can really make a big difference for patients when they first come to the emergency room with a stroke are thrombectomy procedures and also bleeding stabilization procedures. So thrombectomy has to do with when a blood clot is blocking the flow of, fresh, oxygenated, nutrient-rich blood to those parts of the brain that really need it to continue working the way they should. And so when a blockage like that is identified and it happens to be in a place where it's reachable by one of these new tools, the physicians there can actually go in and remove that blood clot, hopefully fully reversing the damage that was being caused by the blockage in the first place. That's not always the case, but very often we can see a dramatic improvement in how the person is doing. And that's a very new and rapidly evolving technology. The other way that we can intervene in a way that's very special and very modern is to stop bleeding. And this can happen with the other type of stroke, what we call a hemorrhagic stroke, where instead of there being a blockage in flow, there's actually blood coming out of one of those pipes, one of those leaky vessels, and traveling to a place where it shouldn't be, perhaps putting some extra pressure on the brain. And so we have the ability to go in, stop that bleeding, remove any of the excess fluid that's putting pressure on the brain and make a big difference in outcomes.
And why is monitoring in the hospital so important after a stroke?
When an individual comes to the hospital, they've experienced a stroke, it's not the type of diagnosis that people can go home right away after, unfortunately. It does require a pretty significant period, usually days, sometimes even weeks of monitoring after the fact. And particularly important during that time, things like blood pressure, things like oxygen levels, things like heart rate, things like ruling out a new blockage or any type of bleeding event. And once a person has reached that point of medical stabilization, depending on how they're doing, they may be able to transition home, or they may be a candidate for an acute rehabilitation experience, or maybe a different type of hospital.
What is an acute rehabilitation?
An acute rehabilitation hospital is often the next step for people after they experience a stroke. It is a place where generally people will stay for a period of weeks, and it is an environment where people can get a comprehensive evaluation, really a look at everything having to do with their daily functioning, walking, getting dressed, showering, swallowing ability, even things like thinking and memory after they experience a stroke. And once any little vulnerabilities or maybe big vulnerabilities are identified in those areas, we start to work on them for hours per day with multiple types of teams to hopefully allow people to get home. We hope that more than 90% of people who come to an acute rehab will actually end up going home with, ongoing PT, OT, speech. These are the types of rehab therapies that are available. As well as ongoing care from visiting nurses, support from family, home health aides, to hopefully jumpstart the process of recovering as much as possible.
And who qualifies for admission for acute rehabilitation, and what do they do?
So if there's a safety issue, if there's a significant mobility issue, if there's a thinking and memory issue that really requires some comprehensive evaluation and critical, individualized thinking about how to speed things along and create more independence as soon as possible. Generally, those are the people that are going to end up in an acute rehab, and it is the recommended discharge destination if people qualify for it after a stroke. Depending on the person's medical frailty, depending on maybe the insurance status, there are a couple of possible destinations other than home, which would be a skilled nursing facility or a nursing home where the therapies can continue, or maybe even a long-term acute care facility, which would also kind of be different roads in the path to recovery.
Sure. And what should people expect in the months and years after a stroke?
So it can be very frustrating, very scary to have your functioning be one way, and then suddenly the next day it is so different. Everything that you do might be different and have to be approached in a different way. Fortunately, when it comes to stroke, even if you've had a first few days, first few weeks that are really frustrating and really jarring in that respect, the weeks and months to come hold a lot of recovery. And so, we definitely encourage people to benchmark the specific goals that they have. What is it that you hope to be doing in the next few weeks, next few months? And when you get there, really, really celebrate that. And if, for some reason memory or, kind of a full understanding of the stroke isn't possible, friends and family participate in that recognition process and practice. That's a huge element in especially the first 6 to 9 months following a stroke.
Okay, thank you so much, Dr. Dwyer, for sharing this with us today. I would like to, again, thank my guest, Dr. Dwyer, for her time and professional insights regarding stroke intervention and rehabilitation. When we come back, we'll continue the discussion on stroke awareness, so stay with us. Welcome back to the Stroke Awareness Project. I'm your host, Maria Cancel. We've been speaking with doctors about identifying and responding to a stroke. Now we turn our attention to what happens after a stroke. Joining me now to do this is Katisa Vega, Community Health Work Supervisor at Brockton Neighborhood Health Center. Welcome, Katisa.
Hello.
Katisa, why is it important to follow up with your primary care team after a stroke?
After stroke, it's critical to consult with your primary care team because you are now at a higher risk of other potentially life-threatening conditions, including having another stroke.
Okay. And what kind of follow-up can you expect by your primary care team?
After stroke, many health centers provide designated appointments for hospital discharge visits. At Brockton Neighborhood Health Center, community health workers contact patients within 24 hours of discharge to ensure that they receive the resources they need. For example, connect patients with their primary care doctor and other resources that can make the recovery easy and fast.
Okay. And what kind of support can primary care offer patients and their families after a stroke?
After stroke, your primary care team can provide a range of services, and we encourage you to contact them to learn more about it. At Brockton Neighborhood Health Center, for example, we have community health workers who are part of the prevention in practice team who assists patients with social needs, such as applying for benefits or getting work accommodations. They can refer patients to life change groups and nutrition groups and connect patients to the same day behavioral health support services.
How does a primary care team educate people who are at a greater risk of developing a stroke, of having a stroke?
Primary care offers educational resources to patients, and we encourage patients to contact their health center for more information. At Brockton Neighborhood Health Center, patients can access several services, including prevention in practice community health workers who educate patients on their health risk, a patient navigator who helps them eliminate healthcare barriers, nurses who provide medication reconciliation, and primary care providers who offer instructions on health monitoring and preventive treatment. We also have readmission group, which includes a medical provider, social worker, community health worker, nurse, and a pharmacy staff to support high-risk patients who frequently visit the emergency department to prevent medical complications such as stroke.
Can you talk a little bit about how the health center's care team can assist people in adjusting to a new lifestyle following a stroke?
So after strokes, patients are often referred to various programs and services that offer home assistance to make everyday tasks such as cooking and showering safer and more accessible. Physical and occupational therapy referrals are also made to help patients regain physical strength. In addition, at Brockton Neighborhood Health Center, we have community health workers and nutritionists who assist patients in making lifestyle changes to prevent future strokes and maintain these changes. These efforts aim to help patients achieve as much independence as possible, returning them to their pre-stroke lifestyle.
Right. Katisa, thank you so much for being here with us today.
You're welcome.
I would like to again thank my guest, Katisa Vega, Community Health Work Supervisor at Brockton Neighborhood Health Center. When we come back, we'll provide some important resources and information about stroke awareness. Stay with us. Welcome back to the Stroke Awareness Project. We hope you gain some additional knowledge and information that will benefit you, a friend, a family member, or even a stranger to receive the fastest and most effective treatment if they ever have a stroke. Thanks to all of our healthcare providers who shared such valuable information regarding stroke awareness. We would like to remind you that it is very important to act fast if you or someone you're with is experiencing stroke symptoms. FAST, F-A-S-T, can save lives. If you see face drooping, arm weakness, or speech difficulty, it's time to call 911. Thank you for watching. I'm Maria Cancel. Take care and be well.